knows that importance of coding when it comes to billing, and they do work hand in hand. That's very good that she's going through that. Okay. But usually people, like what I teach at here in Houston, um, the time frame that the students are on and the amount of weeks that they're on in your class does not permit them to go in it in depth. How long is your program where you are?
It's a year. I started last April 21st. As a matter of fact, I just got a notice that of last year.
Okay.
Some people say they see, but I'm trying to figure out how they was able to learn this in 3 days. Those kind of courses.
Okay, those kind of courses.
I don't see how somebody can learn this in 3 days.
Right. Those kind of courses are folks who are already experienced. Okay, so if you have a background, let me give you an example by what I mean. If you already work in a hospital system, okay, and you are the front desk registrar, you pretty much have some sort of experience with intaking of medical records from the doctor's office for the patient to be admitted. Okay. And you pretty much have that information going. And then so once you learn, you become familiar with codes from the patient's medical record that's sent to the hospital. Okay, and then you become familiar with the medical records, and you've done this time and time, so you've gotten curious about it. And sometimes, if the medical records department in the HIM department needs you to call the doctor's office to get more information from them because you registered the patient, you already somewhere in the midst of all that as a front desk clerk and a registrar, rep in a hospital, you come familiar with that. Okay, if you're a person that has worked in medical records, you're familiar with documentation notes and all what it's saying, but you want to move up and do the work and you want to get that certification. You can get those certifications in 3 days because you're already in the field. Makes sense?
Okay.
Yeah, yes, so ma'am. That's how come. So it's not like, oh my God, they in the class. They shouldn't be in the class and everything is just, no. Now, a person can, in my opinion, where I teach at, let me tell you, they do it in 16 weeks, which is 4 months. But we're not given the curriculum, let me say, the curriculum standard for that school that I teach to go in depth with them because it's a long time. If I do that, they'll take away too much. I only teach them the surface. I only teach them what a diagnosis code look like and how to read it in the book from volume 2 and then volume 1. That is it. I don't go that deep. And I teach them medical terminology and I teach them all about insurance. See, it starts off with medical terminology. Then it starts off with the second thing is for them to learn the medical insurance process. Once they learn the medical insurance process, then they learn some billing and coding a little bit on the surface. And then the rest of it is learning about billing, just billing only. They don't learn the meat of coding to make the billing happen. They just learn a little bit about coding and SOAP notes and what's involved, where they live. And then they know to just code it from there, put a billing there, learn your modifiers, become familiar with that. And then once you do that, then you learn how to do invoicing and how to send out, how to post once you receive insurance information to come back into the office. Does that make sense, sweetheart? That's your 4-month program. I teach at Houston Community College that. Now, at College of Healthcare Professions, where I teach at, I'm trying to remember, and I never could get it down. I think it's a 5 or 6 month program. So somewhere along in the way, I can go a little bit more deeper into the meat of coding because the curriculum standard for that school says I can do that. Okay. Doesn't mean I don't have liberty
Okay.
to do that at Houston Community College. They just don't have the time to get that. But at College of Healthcare Professions, they have time because this is a 6-month program. Yours is a year program. So you're learning everything. Sounds like, you know.
Yes. Yes, ma'am.
Okay. And you've been in this since from what you say, April of last year.
Yes, ma'am.
So April of this year, you'll almost be done.
It's around right at probably the middle of March, end of March. I gotta contact the school and I'm applying for the certification. Since I spoke with you, you explained it more in depth, so then I know if PC sounds like
It caters to a certification that allows their students to get that because they have to sign up with a certification agency. So what certification they have to sign up? So what certification are you getting after you finish the program?
I think it's CPC and CCA or CC another one. That's what AHEMA. They call it a different term.
Okay, so certified coding assistant. Okay, so this is a AHEMA curriculum that you're working.
That's what it is.
It's a curriculum that's
they have they have it either or. It's up to you which one you want to select after you don't finish the course. They give you that option. But since you broke it down to me, it seems like AAPC to me would be better.
Yeah, in my opinion, that's my opinion. I would, and it's easier. Okay, and
nobody, you ain't the only one that said that. I was listening to other people on YouTube was saying that as well.
Yes, and then they cross over to get the CCS. You can get the CCA.
Okay.
It's just as much money. If you still feel like you and that allows you to go deeper, into the hospital setting. Okay.
CCA.
That's the certified coding assistant. So that allows you to go under acute care. CPC allows you to do outpatient and some inpatient. Maybe not as deep, but some inpatient. Once you go for that CCA, the CCA helps you learn. Now that goes over coding guidelines more in depth, Okay. And Jesus, I don't even have the it has 6 domains to it that you have to master, which is really not hard. So once you learn all of this and you master and get your CPC, it helps you understand CCA a lot better. In my opinion, getting your CCA helps guide you into getting your CCS. But there are 6 domains that you have to pass for your CCA, CCS. And then once you get your CCS, that's a higher form right there. Then go for your CCH. There's different kind of CCS type certifications, but CPC is wonderful. I can't praise that company enough. They're wonderful for allowing you to have their certifications and be able to get your foot in the... Okay, good, very good. So go in that order, and I know a lot of my colleagues have they've gone in that order too. So do that. Okay. So that's good. Your school does that. And then when you get some free time after you master that test, I want to teach you how to get your certification in billing and coding. And that won't take long.
Okay.
Now that right there, that's like a 4-week session. And all I'm teaching you more is about insurance. Did you learn about insurance and stuff like that?
At the beginning. As a matter of fact, since I've been doing this, the insurance part to me seems easier than the coding to me. Unless it's just I grasp more of how to do the insurance part a little bit better.
The reason why I would like for you
is that
that is easy certification to get. And I want to teach you how to get that because it's going to play a role in revenue cycle billing, revenue cycle work. And also, Tanae, it'll help you be an analyst in it. How can I say? Like a business analyst or a financial analyst in this. Because to understand billing, you got to understand where everything came from. Coding is the root to how it branches out in trees of money in billing. Without the root, you ain't got no tree. Billing is the tree. Coding is the root. You understand, sweetheart? So when you have that certification,
yes,
you have how can I say, freedom of going wherever you want to go. You can call your shots because you have both of them. You understand, Sweet Pea?
Yes, ma'am.
And that's how I like to roll. I like options. I don't like to be stuck. I like options. That's just always been me. Okay, baby. So that's good. So that's why your program is a year. Everybody else is 4 and 6 months. So I had to explain it like that. Sometimes it's 3, but I can teach you insurance and all like that in 4 weeks. Okay, in 4 weeks.
Okay. I think I want to do that with you.
Thank you. And that's going to help you. I'm telling you, it's going to help you understand a lot of stuff. Because you got some folks, they know coding, they've been in coding all their life. But if you ask them some billing stuff, if something come back from billing and they say, well, they said you code this wrong, this, they're going to be like, well, I don't know what all that is. Why are you telling me this? I just code. Well, at least with you, you'll know both sides and how to handle that. You understand what I'm saying?
Right.
It makes you,
yes,
how can I say? And I don't really like to use the word diva, but I'm gonna say it makes you a diva in your own right of what you do. It keeps you employed. Let me say it like that. It keeps you employed. Okay, sweet love. Any other questions, baby, before I move forward?
No, I'm gonna let you move forward, but I'll ask it at the end.
Oh, okay. Remember to do that. Remember to do that, okay?
Okay.
All right. Okay, we talked about sequencing. Codes are sequenced in ascending and alphanumeric order. 2, you may notice a break in the alphanumeric sequencing if 2 or more codes need to be sequenced together based on coding guidelines or conventions. We talked about that. Remember that we said Streptococcus group A, cellulitis, and then hypertrophic osteoarthropathy of the left leg. We said that cellulitis need to be coded first. Streptococcus A is coded first. Hypertrophic osteoarthropathy is second. Okay? All right. 3. Sequencing in alpha and numeric characters follows the order found in the tabular list in ICD-10-CM or PCS tables. So, for example, secondary diagnosis. Patient admitted at 39 weeks gestation delivered a second live-born female. So Z3A.39, Z37.0. Okay, this is a different patient. We've already talked about this once before, that you have to code the Z3A 0.39, the gestational age of the patient first. Then the health status of the patient, which is Z37.0. Did you get that, sweetie? That's what we talked about last time. Okay. Now here's another case.
Yes, ma'am.
The other case was a patient with primary lung cancer in both lungs had a right and left lower endoscopic segmentectomy performed. Remember that in the ICD-10 PCS book, we had to list the right and the left. Remember that the right was listed first, and then the left. Okay, and each character has its own representation of what they mean. Okay, and I have to find my notes and go back over that with you again. Okay. Number 4, when more than one code is acceptable as the primary diagnosis, the code not used as principal is sequenced as secondary diagnosis. Now, I just got through talking about that with my student earlier before you, because I was with her. I was late. I was real late with her, bless her heart. And she had to remind me. I think of my students that had to remind me about their appointments because Miss Harper got carried away with the snow. It's snowing down here and I got carried away with it, and she had to call me on my phone. Anyway, I was on the phone with her for 2 hours. But my point is, she had to remind me, Miss Harper. Okay, here we go. I just got through talking about that. When more than one code is acceptable as the primary diagnosis, the code not used as the principal is sequenced as secondary. Let me give an example before I go into this case. What I explained to my student previous to you was that, say for example, the patient is diabetic. Okay, so here's the tree. Here's the root. This right here is diabetes. Okay, now the patient started developing hypertension. Okay, the patient started developing kidney issues. Okay, so hypertension, kidney issues. Okay, then you have diabetes. Okay, so now the first thing that the patient is being admitted to the hospital for is kidney issues, number 1, hypertension, number 2, diabetes, number 3. Diabetes is the history. Hypertension is the tree of that history. But it also created another issue, which is kidney problems, kidney issues, or distressful kidneys, or chronic kidney disease, in other words. So the patient is being admitted for chronic kidney disease due to hypertension coming from diabetes. Usually, sweetheart, diabetes and hypertension go hand in hand. One day I'm going to explain, because I used to be a diabetic educator. One day I'm going to explain how that happens in a deeper level, but on a separate video. Okay. And when I do, I'll send it to you. Remind me. Okay. And I'll send it to you. Okay. Now let's read your case that you have right here. Let's read your case that you have right here. Patient was seen in the emergency room. I'm on number 4. Patient was seen in the emergency room post the fall. Patient suffered fracture of the proximal end of the right radius. That's dealing with the arm shaft up here. You have, I forgot, I think it's radius this way, ulna that way. I'm trying to remember correctly, and we'll go back and look. And if I'm wrong, please correct me. Okay, so patient was seen in the emergency room post the fall. Patient suffered fractures of the proximal end of the radius and shaft of the left humerus and contusion of the forehead. Okay, now principal diagnosis is S52-101.A. 101A. What is that? Because I need to see that in the book.
You want me to look up what 101?
Yeah. Look up that first code because I need to see what that is.
Call it to me again.
The first code S52.101A. S52. So what chapter is S? You got to look and see what chapter is S.
It's going to be injury, poisoning, and certain other consequences of external causes.
Okay. QRS. Yes, you're absolutely correct. That's chapter 19. Injury, poisoning, and certain other consequences of external causes. Okay? All right. S52. S52. S52 point. S52 point. Hold on, baby. S52 point. Going in my book. 0.10. Here we go. 0.101. There we go. Unspecified fracture of upper end right radius. Upper end of right radius. Okay, so we found S52.101. Okay, now we need a seventh character, which is A. There's that pink looking box. It says the appropriate seventh character is to be added to all codes in subcategory S52.11. Did it happen with letter A, which is initial counter for closed fracture? Did it happen with D, subsequent encounter for fracture with routine healing? Did it happen with G, subsequent encounter for fracture with delayed healing? K, subsequent encounter for fracture with non-union? P, subsequent encounter for fracture with malunion. Or S, sequela. Sequela is late effect. Late effect. Do you see? It should. Okay, in my book is a peach color box with all these alphabets. What color is your box?
It's the same peach color.
Okay, peach color. Okay, so your alphabet in the note, it says here that the patient was seen in the emergency room post the fall. The patient suffered fracture of proximal end of the right radius and shaft of the left humerus and contusion of the forehead. He's being seen with this for the very first time. For the notes gives you indication and understanding that he's being seen with this for the very first time. Do you understand, Sweet Pea?
Yes, ma'am.
Okay, so what letter are you going to choose that matches this at best perfection?
A as an apple.
A as
Because
in
that's
apple.
initially counted for closed fracture.
Yes. Now, do you see that? Okay, now it says principal diagnosis S52.101A or S42.302A is giving you an either or choice. But let's take a look at that. I want us to take a look at that. Let's go to S42 because I want to get a clear understanding what S42 is.
You said S42.
Yeah. S42.302. 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 Okay, I found it. Okay. Now, this is under fracture of shaft of humerus. Okay, this one says unspecified fracture of shaft of humerus of the left arm.
That's correct.
But it wants you to choose a seventh character. Now, the seventh character, again, it should be A for initial encounter for closed fracture. Okay. Now, what it wants you to do is choose a code that best suits the situation. In my opinion, I would choose S52.01 because it talked about the ulna and it also mentions the humerus. I think that's what it said in that code right there. I would choose that. If I wanted something that was a bit more specific in noticeability and is documented that way, I would then use S42.302A because it's noticeable more in the humerus, but it started in the radius area. But they have something more noticeable about the humerus, about the arm, the upper arm. So what they're saying, you could choose either or. But if I was coding the situation personally, I would choose S52.101A. That is what I would choose. That's just me personally. Okay. Now, secondary diagnosis would be S, something dealing with the fracture of that S00.83XA. And then the other codes or the other codes. It all depends on how it's noted in the notes on how you want to sequence them first. But the main reason why the patient is there because they had a fall and they injured their radius, and their ulna, which affected their upper arm.
Okay.
Do you have a question? You look like you have a question.
Oh, no, I'm writing it down as you speak. But I was going to say, okay, I forgot what sequela meant. Because I know in the box, the tan box, it goes by initial, subsequent, but I forgot what the word sequela meant. Because that's usually in all the boxes.
Right.
Okay.
Okay. Let me understand what that means. If Jolene fractured her leg November last year, and Jolene has been wearing a fracture from November, December, January, and she gets her cast removed this month. And let's suppose, okay, now we getting snow down here. I don't know if y'all ever got snow, but we getting snow down here in Houston. Did y'all get some snow?
2017, last time it snowed. No, it don't really snow in North Florida. It was 2017.
Y'all didn't get any this time? Y'all didn't get any? Y'all didn't get a forecast of it?
No, but we got rain and cold weather.
Oh, okay. Well, we got snow. I'm gonna have to send you some pictures. You know, Houston, we don't get much snow at all, but we would. It's like a treat for us when we get snow. It's a treat. So let me go back to Jolene. Jolene fractured her leg in November. She got a cast put on her leg in November after she had fractured it. So her primary diagnosis should be she came in for a fractured leg from falling outside, I guess. So she got a cast put on her leg for November, December, January. She got the cast taken off in January. She's healed and recovered. She's going through therapy, making sure she constantly had her x-rays, blah, blah, blah. Somewhere in the midst of all her follow-up visits in February, she says, oh, I've been feeling some awful pain in my leg. But now notice the weather outside changes. The barometric pressure, I'm just explaining extra details. The barometric pressure has come down. That's invisible gravity. So you're going to always hear somebody say, it's getting ready to rain, or the weather is changing. I can feel it in my bones. You ever hear that before?
Yes, ma'am.
Okay. Sometimes it's all dealing with a person's wear and tear of their bone, or if they fractured and hurt they bone somewhere in their body. So Jolene says, oh, I'm in so much pain. I don't know why I'm in so much pain. The doctor said, well, what did you do? I don't know. I'm just in pain. I'm just this leg. Oh my God. It just hurt. So they take an x-ray. They say, okay, well, your legs look fine. The fracture healed up. I don't understand why you having so much pain. Oh, wait a minute. Let me look back in your notes. You fractured your leg back in November. So now you're feeling the after effects of your fracture. Even though you healed from all that, you still feeling the after effects. And the weather outside is changing. So sometimes they're going to feel that effect in their leg, and they're going to go to the doctor, like I've done times before, hollering and screaming because, oh my God, my leg is killing me. Why is it hurting? I haven't hurt myself. I don't remember twisting it wrong. Oh my God, I'm in so much pain. What is this? It is a sequela. The pain is a late effect of a leg that was previously fractured. That person will forever have that late effect. Does that make sense, sweetheart?
Yes, ma'am.
Okay. I could feel it in my hips and in my lower back when the weather changed. I had hell the last 2 weeks. And it ain't that I fractured my hips or my back or anything, but because I've been obese for the majority of my life, except for 7 years of it. The wear and tear of extra weight on my body has caused wear and tear on my hip joints and my lower back. So whenever the weather changes, I can feel it. And I'm on a cane quick, fast, in a hurry. Then other days, I don't need my cane. I feel just fine. Those are late effects. Okay. Or late effects of a development of something that you suffered from before. And that's my personal late effect. I didn't fracture anything. It's just I've been heavy set for the majority of my life. And that's the fruit of my problem. Does that make sense, sweetheart?
Yes, ma'am.
Okay, very good. Okay. So again, now you see the case right here, sweetheart. It says the patient was seen in the emergency room post fall. The patient suffered fractures in the proximal end of the right radius and shaft of the left humerus and contusion of the forehead. Now, these next S codes are going to also speak of a contusion of a forehead. In your best judgment, and it has to be within the coding guideline today, which codes is giving you a choice? Which codes would you choose tonight in this coding situation number 4? So you're going to have to Go ahead.
No, repeat this, my scenario, so I can choose my code.
Okay. Your scenario says the patient was seen in the emergency room post a fall, after a fall. The patient suffered fractures of the proximal end of the right radius. Oh no. I hope I'm getting that right. And shaft of the left humerus. And a contusion of the forehead. You want to look up either S52.101. So your mind is going to think, okay, this person hurt, they suffered fracture of approximate end of the right radius. So I'm going to look up fracture first, and then I'm going to look up radius, and then I'm going to see if it says anything about proximal end, and then I'm going to see if it's going to make mentions of a humerus.
Okay, fracture.
So what I'm trying to get you to do is think, process how you're going to categorize this. So I want you to look up both.
Fracture.
Mm-hmm.
I'm listening to you. Go ahead.
I want you to look up both of them, and I want you to make your best judgment. Because you may think one way and find this code, and you might think another way and find the second code. But you got to choose. Then you got to defend and tell me why you chose that.
Fractured.
Mm-hmm. Go to fractures. In volume 2, you go to fractures first. That's the condition. Your condition is fractures. Now you're going to find what?
Proximal.
Okay.
Did I write that right? Hold on, let me see how I write that. Fracture of the proximal radius. Yes, I am right. Okay. When I go to proximal, it tells me end. See fracture radius upper end.
Very good. It's
directing me to go to another section.
Very good. Yes. Keep going.
Fracture radius upper. Okay, that would be S52.10.
All right.
First I come to radius, then I'm going to proximal end. Proximal end has led me to go fracture radius upper end. So I go down to the upper end, and that will be S52.10. But I have a check, which I got to have a 6-digit.
Okay.
Is it 6, 7? Hold on. 1, 3, 4, 5. That's a 6-digit. So I've got to verify this in the tabular list.
Okay.
Tabular list.
All right. Okay. All right.
It's 110. So that's S52.10. Three. That's 1.10. Okay, S52.10.
Mm-hmm.
That's concussion? No, contusion of unspecified forearm, but it's asking me because it's in gray, it's saying 7th digit, so I need an extra digit. And we talked about the okay. I believe this was initial because it didn't say they had. That's right. So go to S52.10A.
Where's
Initial?
the one? Okay, wait a minute. Your book is a 2021, isn't it?
No, I have a 2020.
Okay. All right. So it didn't give you a 101.
No, because it told me I needed the digit, so I've got to go up to the tan or the peach color box you called it.
Okay.
See if it's initial, subsequent encounter,
okay,
or a sequela.
Okay. So in this, you're going to give it an X. You gotta use the X, and then you gotta give it either A, D, or whatever those alphabets are.
Okay, now I want you to tell me, why did I have to use that X and then do the A? And break that down to me.
Is it requiring you use a 6-digit or a 7-digit? Because the book I have is a 2019. So your book is a 2020. So is it telling you in the red box next to it that you need a 6-digit or a 7-digit?
7th digit.
Okay. The X is an anchor. So when you anchoring, you have to put an X there to make it a 7, to give it a 7-digit. So your code should read in your book S52.10XA. That would make it a 7-digit.
Okay.
The coding guideline says when you're using a 7th digit. So your book read S52.10, right? And how many characters are right there? Those are 5 characters. S is 1, 5 is 2, 2 is 3, 1 is 4, 4 is 5. But that red box is telling you, that red box checkbox is telling you that you need a 7th character, right?
Yes, ma'am.
So you're going to have to use X as an anchor to make that number 6. And then A is going to be your 7th character. That's in the coding guidelines in the front of the book. I went over that with my other student, but I didn't go over that with you.
Okay. But I wrote that down about they're asking for the 710, what you explained to me what the X is. An anchor.
It's an anchor. It's an anchor so if you use, let me give you a visual. If it says it needs a 7th character and you saying S52.10 and then you're going to put an A right there. Well, then if I say S is 1, 5 is 2, 2 is 3, 1 is 4, 5 is 0, and A is 6. But the coding guideline says I need a 7th character. So where else am I going to get the 7th character? How am I going to make this happen? And the coding guideline says you have to use an X to help connect that A, so that it'll make sense that all the characters has this place of being 7.
All right, I got it.
I know it's going to take you a minute. I know it's going to take you a minute. I just want you to understand it. That's why I'm doing this on YouTube, so you can play this over and over again. Okay?
Yes, ma'am.
So you got it, Pumpkin. It's just my book is a 2019 and your book is a 2020. So some things have changed because in my book it's a little different. Okay, and I use old books. I teach it, but I know how to make it whatever. Okay, secondary. Now, are you going to use, now listen, fractures, plural, of approximate end of the radius, that's 1, and shaft of the humerus. Okay, now, does that code that you find justify that code? Does that information justify that code? Let me ask you this. What does that code say?
It does, but it only justifies 1. Now I got to do the shaft of the left humerus. We did the radius.
Okay.
What was it? The fracture of the proximal radius.
Okay, it doesn't mention humerus at all?
Let me go back to... It said fracture radius upper end in my book.
Okay.
So when I realized that, I was like, oh, and I look back at my notes, we mentioned something about shaft of the left humerus, the shaft of the left humerus, and we got to do the contusion of the 4.
Okay,
head.
But that one code that you have in your 2020 book, it only mentions the proximal end of the radius, right? In ulna. Does it say that? What read your code, baby? Read your code you just found.
I think the one I'm reading is the wrong one. I think I'm reading the concussion of the... I think I'm doing it wrong.
Okay.
Or the forearm.
Okay.
Now that I'm looking. No, I did right. Okay, left, right elbow, contusion of the right, either unspecified, either a left or right elbow. No, I'm right. S50.0.
0.1. It should be 0.1.
Oh, yes, that's right. It's forearm. That's right. 0.10, and then it asks for the 7th character, which will be, we talked about X, which is call that
an anchor.
What was that term? Anchor. I couldn't think about it. Okay, anchor, like on a ship, anchor. Okay.
Right.
I think I can remember it now.
Mm-hmm.
Visualizing.
Mm-hmm. Mm-hmm.
And it'd be initial A, XA.
Okay, so what is that code? I'm trying to get you to understand, what is that code saying in terms? What is the sentence structure? What is it reading?
Like what this is under?
Yeah, what is the
Like
code
superficial
saying?
injury of L.
What is the code saying, sweetheart? So, for example, if I'm asking you, does it say fracture of unspecified part of scapula? Does it say fracture right?
Contusion of unspecified forearm. That's what it is.
Okay. Contusion of unspecified forearm. Okay. All right.
That's correct, because I don't remember. The only thing we did a left was the shaft of the left humerus. So I think we would have to look that one up.
Okay, of the left foot, but it says left forearm, right?
Yes, ma'am.
Okay, does it have another code for the right? Does it have another code for the right forearm?
Yes, it's a different code for the right, for the left, and for unspecified, if you didn't know.
Okay. Now look at your
Which
notes.
one?
This one says right radius. So choose the one that says right because it gave you a specified definition.
Oh, I didn't do that right. S50.11XA.
Yes.
Sorry about that. Thank you for telling me.
That's okay. No, you're getting it, honey.
Right.
That's why I'm taking my time. Now let me write this down so I can update this. What is it? S52.10 what?
S50.12A. No, 12XA. We talking about the left.
But this is talking about the right.
I'm sorry, right. I'm doing the wrong left, right. No. S50.11XA.
Okay. So it's 1-1.
Yes, ma'am.
Okay. Okay, so it's S5211XA for the right forearm. Right?
Yes, ma'am.
Okay. Now, look at this. Go back to fractures. Go back to the volume 2, go into condition fractures. And go to
I'm there.
Okay. Go to shaft.
I'm there.
Okay. Look up
You said shaft, and what was the other part?
humerus. The body part humerus.
Okay, I gotta get a little assistance with that.
Okay.
I'm not finding
okay.
fracture.
Mm-hmm. Okay, do you see anything that says shaft?
Yes, ma'am.
What is it telling you, sweetheart?
Oh, I gotta go to the tabular list. I'm sorry. And I gotta get another digit. 1, 2, 3, 4, 5. So only have 5 digits. So
okay, but listen. Okay, now it's
character required, so I need to go to.
Okay.
I'm listening.
Okay, so it just told you shaft. It didn't give you any subspecialties as far as body parts in volume 2, right?
No, ma'am. Was it supposed to do that for me?
It could or could not. But if it did not, now it's up to is leaving you in a broad thinking that okay, let me go look up this code that says fracture shaft. Then once you find fracture shaft, then in volume 1 it's going to give you specificity. It's not going to always do that, sweetheart. It's not going to always do that. You understand, baby?
Yes, ma'am.
Okay.
Which I need a 6 character 1, 2, 3, 4, 5. And this was initial encounter. So it'd be S52.30A, initial encounter for closed fracture. One, 2, 3, 4, 5, 6A. Okay. Anchor. Next would be so am I the correct code? Or just explain?
Now you found shaft. Did you find shaft?
See, is this one the one? Shaft. That's the S52.30 would need a a 6 character. So we're gonna do S52.30. Two. I need a 7th character. 1, 2, 3, 4, 5, 6 with an initial A. So this is the correct answer. S52.302A as an apple. Because that's the unspecified fracture of the shaft of the left radius.
Okay, but it should be wait. It's okay. We already entertained. You already did the radius. We're talking about the humerus, baby. We already talked about the radius.
I'm sorry, I just realized that.
Okay. I'm patient. I want you to get an understanding. The Bible says, "And all that getting an understanding." I want you to get this.
How did I get to the radius? Humans. Let me go back to the fracture. Humorous. What is it? Humorous. Humorous. Lauren. Mm-hmm.
Oh, girl, I'm eating up all this granola bar. I should be taking my phosphorus tablets. Where my pills at? I've been eating up granola bars like crazy. My nurse found out I was eating like this, she'll be screaming.
M96.62.
Wait a minute, honey. What are you looking for? Humor?
Because we're talking about I'm looking for the humerus. Remember, I keep telling you the wrong term. Shaft of the left humerus. I wasn't giving you that. I was giving you, I think, the opposite of it. So I've got to go find shaft. Where did I find that one? I think I don't confuse myself. Hold on. This again. Let's see. If I'm right. It's 4.2. Okay, yeah, okay. I think I'm in the right section.
Okay.
S42. I gave you the wrong one. S42.30. Fracture humerus.
Okay.
Because I don't see shaft, but it says fracture humerus.
Okay.
Go to the tabular list, which is on the back. What was I saying? S42. S42.30.
Mm-hmm.
Which is a fracture of the shaft of the humerus. But we talked about it is the left. So I need to look up the left one, which is going to be S42.302, and it needs a seventh character, which would be initial A. S42.302, A as an apple.
Okay.
That'll determine unspecified fracture of the shaft of the humerus, the left arm, initial encounter.
Okay. Okay. Now look at this.
And that'll be 7 characters.
The situation says proximal end of the right radius and shaft of the left humerus. Okay. Since it mentioned the right radius first, and I think I caused a little confusion, so let me straighten that out. You're going to code S5211XA as first. Okay? Comma.
Okay.
Then you're going to put S42.302A. Is that what you have?
Yes, ma'am.
As second. Oh, very good, girlfriend. So this is how your code should look. This is how it should look. Let me write it down. Let me get a marker. Because I wanna erase kind of what they have on there. Because if I don't erase what's on the case study and make it make sense to you differently, then you'll constantly see it that way when you get ready to study your notes. And I want to make it plain. Give me just a minute. Let me get a marker. Let me get a marker. So it should be looking like this. S52.11 XA, comma, S42.302A. It should look like this. Not no or in the middle. No or in the middle. That's what's throwing it off. So when you get ready to put it in box 21 on your CMS form, CMS 1500 form, or your UB04 form, I forgot what box that is. It should be this in the first box, this in the second box, not an or of a choice. Because your notes first stated the right arm, the right proximal upper arm was fractured. Then it stated that the left humerus was fractured. So it mentioned the right arm first, the left arm second. Do you see what that is saying in the notes? Are you paying attention?
Yes, ma'am.
So
I've seen what you just wrote in here. You're explaining it to me.
Yeah. So it's not an or. The way it's listed on this career step thing, it's not an or a choice. This is what it is. Okay.
I have it.
All right, sweet angel. Now let's move on to the next case here. And I want to finish all this so we can get to abstracting. Okay. We can come back to the secondary diagnosis a little later. Okay, but you get the gist of what's being said, right?
Yes, ma'am.
Okay, so let's go on to number 5. If a secondary code is related to the primary or principal code due to a coding convention or guideline, that code will be listed as the first secondary diagnosis code. Okay, so let's understand something first. Principal diagnosis. Okay, principal diagnosis is dealing with inpatient. Okay, I'm sorry, not principal. Primary. No, I was right. Jesus. I was right. Primary diagnosis deals with outpatient, such as a doctor's office or outpatient facility. Primary diagnosis deals with inpatient. This deals with your UB04. Principal diagnosis. Primary diagnosis deals with your CMS 1500.
Okay, I have that written down.
Okay, very good.
UB04 is
UB04 is the Uniform Bill. That's the term. That's why they use principal for inpatient care. Primary diagnosis is what is the primary reason this physician in the office, or what is the primary reason why this patient is having an outpatient surgery procedure. And those are usually done on a CMS 1500. There's two types of forms in billing, the UB04 and then the CMS 1500. So in coding, you have to understand the terminologies and how it's being exchanged. It means the same thing, but one means inpatient, the other means outpatient. Okay, sweetie?
Yes, ma'am.
Okay. All right, so let's go back to your case here. Example, diagnosis. Patient was admitted for management of acute on a chronic diastolic congestive heart failure and stage 4 kidney disease secondary to hypertension. Okay, so that means the person had hypertension first and then they developed chronic kidney disease. The patient was also evaluated for Meniere's disease of the right ear. The principal diagnosis of why the patient principal is patient was admitted. So circle this, patient was admitted, circle it, or write it down for management of acute on chronic. You can call acute and chronic. Okay, you can do that. There's a coding guideline for that. Okay, diastolic congestive heart failure and stage 4 kidney disease to hypertension. The patient was also evaluated for Meniere's disease of the right ear. Principal diagnosis is I13.0. We need to find out what that is. Then all the other second diagnoses following. So I'm going to do a quick one instead of me going through the book. And you can do it too if you want to, because you already got the gist of how to go through volume 2 and then volume 1. So just go through your cell phone and Google it so we can understand what the codes are in a quick manner, because I'm trying to get to the next thing.
Okay. Okay. I13.0 hypertensive heart and chronic kidney disease with heart failure and stage 1. I think I'm looking on the AAPC, but yeah, I went 3.0.
Okay. Hold on, sweet pea.
Yes, ma'am.
Okay. Capital I and then 13.0. Let's write that down. Come on, you know that's what I asked for. Hypertensive, so I'm gonna write that down next to it. HTN, hypertension. That's an abbreviation, sweet angel, that you're gonna have to get to know. Did I tell you this once before? Maybe it was another student. You need to get you a book of medical abbreviations. You need to order that. Okay, even if you have to order from Chegg or thrift books or half price books, fine. It doesn't matter if it's 2015, 16, 17. It doesn't matter. If they got a 2021, that's great. But you need a book on medical abbreviations. Okay? And you need to make that part of your personal library. Okay, so hypertensive, heart, and CKD, chronic kidney disease. You need to make that part of your abbreviation, CKD. With heart failure and stage 1. Okay, now here's a secondary diagnosis. Let's look what all that is. Let's go back. Let's Google that. I'm trying to speed up the time because I want to get to your abstraction of your case studies here. I don't want to keep spending all day on this.
Okay, the next diagnosis is
N18.4. N18.4. Chronic kidney disease. So say that is CKD stage 4. Okay, Meniere's H81.01 is Meniere's.
Repeat the last one.
Okay, H81.01.
Okay. H81.01. Billables, Meniere's. That's how you pronounce it?
Meniere's.
Disease. Mm-hmm. Okay, I pronounced it right. Okay. Meniere's disease, right ear.
Mm-hmm. Mm-hmm. Sweet Pea.
You want me to read it to you? Oh. Yes, ma'am.
Go ahead.
Repeat it, please, again.
Yes, ma'am. Okay.
No.
Okay. The second code I got is that I Googled H81.01. That's Meniere's disease of the right ear, and then I50.33 is acute on chronic diastolic congestive heart failure.
That's why I don't have. I50.
I50.33.
Are diastolic congestive heart failure. What it's called.
So the principal diagnosis for the patient being admitted is hypertension, heart and CKD with heart failure and stage 1. Then the next code after that is N18.4 CKD stage 4. Then Meniere's disease of the right ear. Then acute on chronic diastolic heart failure. Okay, so did you get it, Pumpkin? Oh, excuse me, honey bun.
Let's go. I50.33 or I50.33. No, I don't have something like you mentioned that earlier.
Yes. You got it.
Okay.
You got it, Pumpkin. I know it's a lot, ain't it, baby? I know. Bless your heart, but you can do this. You can do this, sweetie. I know you can. I have pure faith in you. Okay. All right. Let's see. What is the last thing on here? I got another one of these. Okay, I got number 6. Let's talk about number 6. Okay, external causes of morbidity codes are sequenced in the same order that has been used in previously throughout the course. Cause of injury, activity, place of occurrence, and external causes, CAPE. Okay, CAPE. Okay. If more than one single of a type of external causes of morbidity code is assigned, that is 2 causes of injury codes, these are sequenced in alphanumeric order. So it says here, while washing dishes at her kitchen sink, patient suffered a skull fracture with an overhead light fixture fell on her secondary to a minor earthquake. So the person adventured an earthquake. These are your external codes. Okay, these are your external codes, and things like train wreck.
Okay, since you spent, we need to talk a little bit more about external codes since you mentioned that too.
Okay. So
okay, I know it's external causes, but sometimes, let's say when we go to like accidents, when we go to like falls, things of that nature, I've been having some scenarios with those type of external causes index, different ones.
Mm-hmm.
Because it'll say like fall and what was you like in a fight, or it's more in depth. It's more in depth than what I thought. Whenever you seeing those type of scenarios, when you're doing the external causes index.
Yes, ma'am. Yes, ma'am. Now, if you notice in your ICD code book, in volume 2, let's go back to volume 2. Volume 2, hold on, this is, okay, neoplasms. Okay, so then after neoplasms, you have drugs and chemicals. Okay, some things in drugs and chemicals, a person could accidentally poison themselves, or a person could have been accidentally encountered with a chemical problem, such as a person may have had Clorox thrown on them. Okay, been attacked and they had Clorox thrown on them. Okay, so you would go back and use that list of to find out what kind of chemical or drug was used to attack them or they got sick from. Sometimes a person can be sick because of a reaction to something. Maybe they use Tide detergent and they found out that they had a adverse effect to using Tide detergent. Okay, so that's why you would use your drugs and chemical list. Okay, and we'll talk a little bit more about that. Your external causes. Okay, so say like you said, someone, if they fail or they have a fight. So let's go to external causes and let's look at an accident. Let's look at an accident. Are you there at the accident?
Okay. You want me to go to the external causes?
Yes. Under volume 2.
I'm here. But yeah, accidents is very broad.
Yeah, it is very broad. And you have to know specifically what type of accident was it.
That's correct.
Okay. It could be
it's actually got just about every accident you could think of in
here. Yes. Okay. Now, they got a lot of streetcar accidents, cold car, dirt bike, what else? Passenger collision, road roller, motorcycle. I'm just skipping through pages here. 3-wheeled motor vehicle occupant. You know, those folks like to ride those recreational vehicles. Again, transportation of a hanger on. I guess those hanger-ons that when you go on a vacation and you doing those sky hanger thingies. Okay. It ends right there. Accident. Then it goes into acid throwing. There we go. Assault. Do you see that acid throwing assault? Once you use that external code, now they got to do a more definition to find out what type of acid was that caused that person's face to burn or be necrotized. Yes, ma'am.
No, I'm listening to you, but I'll tell you what it is. Well, son, I just came across a scenario in my class.
Okay.
Doing medication. I know the majority of the medications you're going to look in the HCPCS for for medications, correct?
Okay, the HCPCS does have some list of medications. Let me double check that to be sure.
Because the reason why I asked, I came across a scenario of a person that was on long-term prednisone, had diagnosis of HCPCS was actually CD9.
Okay, now let me get you to understand. Go ahead.
My thing is, what difference of that when it told me IV medication, Phenergan, Toradol, and HCPCS when it comes to long-term care, somebody on prednisone, it was in the ICD-9 for that.
Be using in home health. So say like if the scenario that the person has osteoarthritis and the patient has a, let me see that, like a tracheotomy, and they have to have a feeding.
Okay, no, that is.
They have to have a feeding. Okay. You would use, the feeding is a feed the patient. So you would have to use a HCPCS to define okay, here it is. To define what type of feeding it is, and is it internal feeding. Okay, so if a person is, let me give you an example. Let me find a more, okay. In the HCPCS books, internal formulas and feeding and additives, go to HCPCS B4150. Now, a HCPCS code is categorized as a procedure code. However, it does tell us if the patient is being fed. Being fed is a procedure, and it's a taking in of what they're being fed of. Okay? Being fed is a procedure. Go to best yet, start at B4034.
B40.
B4034.
What's the rest of the code?
B4034. Okay.
Internal feeding supplies kit.
Okay.
Syringe fed per day. I know exactly what internal feed, and I know exactly what it is. Like G tubes, person can't swallow, so they put it through a different method to get that person nutrients.
Okay. But prednisone, now when I go to the drugs and chemicals, okay, now I found the drug prednisone.
What was it under? Long term. Hold on. Oh, I'm gonna find it. Was it entry? Okay, yeah, long term. That's what it is. It's on the long term. And then you find steroids. That's it. So that was my explanation. It's on the long term, then steroids, then either it's inhaled or systemic, which will be, most people I think is systemic. If not, then you have to, I guess, help. But I was trying to figure out why was that long term in steroids versus being in the HICS. The other medication that I looked up, which was IV, was in HICS.
Okay. Okay. But you mentioned something about prednisone, which is a steroid. Why did you mention that? Say anything about the patient being on prednisone? Did it say anything about the patient being poisoned?
Yeah, for a long time.
Okay, he was on prednisone for a long time.
Yes, ma'am.
Okay. Okay.
So is it because of being on it for a long time that makes the difference being in the ICD-9 versus in the HICS when finding med patients? Or it doesn't matter?
I think it may have been, I need to see that case, but it may have been that they mentioned that the patient had been on steroids for a long time to keep from having so much pain. Steroids are known to use for the patient to keep from having so much pain, whatever that may be, of their disease, whatever that may be. That's just a mentioning. Because you don't want to mistaken using HCPCS as a diagnosis code. That's what I'm trying to make clear. Keep HCPCS as a procedure code. Never use as a diagnosis code.
Okay, procedure.
But when you get a chance, find that case and let me see it. But did you find prednisone?
Let me see if I can get it.
Did you find?
I found it under ICD-9 for under long term. Yeah, long term. Like you said, that person, they've been on it for so long. You said for pain or something of that nature.
Right.
Okay.
Right.
I'm gonna find the case real quick. I'm gonna find it real quick.
Okay.
Get it up. Let's see. We haven't spoke much about medications. Speaking of medication, I don't think we went in depth on that either.
Okay.
Find medications, you have to deal for patients.
So when you say about medicines, now in the ICD, no, that's in the CPT book. In the CPT book, if you're coding for medicines or vaccines or something like that, But I really
Okay, I know what it,
okay.
table of drugs and chemicals in the ICD-9, ICD-10, excuse me, book. When do you use medications out of here, out of an ICD-10 book?
Okay. Let's go back to you're not okay. Let's go back to prednisone. Did you find prednisone in the ICD-10 book?
Yes, ma'am. On the long-term therapy.
Okay, I want you to take long-term therapy away from
And then it was under there steroid. Okay.
Okay, you're going back to your case. Let's come away from your case. I want to show you something different. Okay, can we do that?
Yes, ma'am.
Okay, go to your ICD-10 book and go to the drug named prednisone. You mentioned prednisone. I want you to go to that. Just go to drugs and chemicals and then find prednisone. And when you do, let me know.
I have it in ICD-10.
Okay. Now, go to poisoning, accidental. Then it says assault. Okay. Now, poison themselves. Or the patient was accidentally poisoned. And poison could mean they mixed 2 or 3 drugs and they nearly like died from it. This, how can I say, category of codes for drugs potentially trying to commit suicide. It would have to be something written in the record to state one of these categories of uses per drug. And let's look at the last category. It's underdosing. That's me right there because I can be non-compliant at times. I may not be giving myself my vitamin D pills prescriptions all the time like I should. I'm underdosing myself. Or I'm underdosing myself in prednisone when I should be taking it every day, 1 pill a day, and I'm not doing that. So I'm underdosing. When it mentions in the SOAP notes or a patient note that they're underdosing themselves, it's because their bodies is still reacting to a sign or a symptom that caused them to take the medication prednisone, and the doctor is trying to figure out why they're not taking it. Sometimes these doctors will get notes from the pharmacy, and it'll show the pharmacy how often they asking for their pills. And if they're not asking for their pills on a regular, on a 30-day, then that leaves the doctor to a question of, are you taking your pills every day? I'll tell my doctor, oh, some days I forget. Oh my goodness. Okay, then you're underdosing yourself. The prescription says every day. So this is why your body is not acting the way it should, because you're not giving yourself that prescription per instruction. The instruction says 1 pill a day. You doing 1 pill every other day or as needed. So you're not compliant. This is when you would use this, if it's mentioning that. And then you would use a code that would match that situation. Now, if it says, sweetheart, that the patient is on prednisone while he's in long-term care, that doesn't mean that you need to code for prednisone. It's just mentioning that they're on prednisone. If I'm reading this case that you're telling me correct, but I would have to see the case.
Okay.
But now, if they say that this person is on formula, they take this formula every day, twice a day, and I worked in home health, and sometimes a lot of times we would use these codes in order to ship out formulas. So we would have to count the cans every time. Okay, 94 cans. 94 cans, I'm just saying, for instance, should equal 3 cans a day for a whole month. This is when you use these HCPCS codes for formulas. Or it may say so many bags of formulas for tubule feedings. We have to count how many bags, and we also have to count how many supplies it takes. See, there's B includes but not limited to feeding and flushing syringes. So we have to also count so many syringes per day, or so many syringes that's needed for them to flush, to make sure that the patient is getting an easy flow of feeding through their stomach, through their throat, through their side, however the feeding is administered. Am I making sense, sweetie? So if the scenario says that the patient is in a long-term care facility, the patient was diagnosed with, I don't know, whatever, and the patient is receiving so many feedings per day. So you would, if you're trying to bill for feeding on a CMS 1500 form, then this is what you would bill for. You would have to say the patient diagnosis is gestational feeding or something to that effect. Then you would code, give a procedure code of a B4034 and a, let's say, for example, a B4155, internal formula neutrally incomplete modular nutrients, including specific nutrients, blah, blah, blah. So you would have to code for the kit, and you would have to code for the feeding. Okay. If it mentioned anything about, then you would have to say the person had an adverse effect to the prednisone, and you would also have to say in some fashion answer what you're asking. Okay, I don't see okay, ferritin. I know ferritin. So if he's having an adverse effect to ferritin, then you need to put that on there. But I really have to see your case in order to know how to help you.
Trying to find it on my class.
Okay, but you would never use a Hicks.
Email it to you.
Okay, but you would never use a HCPCS as a diagnosis code. Never. It's always a procedure code forever.
Okay.
That's what I want you to get, sweetheart.
Okay.
That's what I want you to get. Okay, let's take a peek here. Let's go to, it says here, while washing dishes at our kitchen sink, the patient suffered a skull fracture when an overhead light fixture fell on her, secondary to an earthquake. So the earthquake happened. So it's let's put in W20. I want to see, make sure what that code is, because I don't know what that code is. I'm gonna send you this link that I like to use online. Hold on just a minute. If I can just get it. Come on. Hold on, sweet angel. Ugh. It is not letting me do what I wanted to do. I am frozen. Okay, let me look on my computer. I like to Google on my phone, but let me look on my computer. Give me just a minute, sweetie. Okay. W20.8XXA. Okay, let's see what that is. Okay. So object initial encounter. Okay. So other cause of strike. Okay. XX. Nope. X34.123.
You said
W20.8XXA is other cause of strike. Yes, you got it. Okay. Now let's look at the next code, sweetie. X34. Now that's not an anchor, that's a real category. X34.XXXA.
It's an X34.
Point XXXA.
Initial encounter. Okay.
Okay.
Couple of anchors and then initial encounter.
There you go. There you go. You getting it, girlfriend. You getting it. Okay. Y93.G1 is activity, food preparation.
That's correct.
Okay.
Activity, food preparation and cleanup activity, dishwashing.
And then Y92. Okay. Y92 is kitchen single family. You can say private. Place of occurrence. Place of occurrence, where it occurred.
Single family, non-institutional. Okay.
Mm-hmm. And then Y99 0.8. Y99.
Other external causes status.
Mm-hmm.
0.8.
Okay. Now let's reread the case here, and so all these codes will make sense. While washing dishes at her kitchen sink, the patient suffered a skull fracture with an overhead light fixture fell on her secondary to a minor earthquake. Okay, so other cause of strike that fell on her head, earthquake encounter, activity, food preparation, cleanup, kitchen, single family, private home, and other causes of external. Okay, now to me, in this thing here, everything is sequenced correctly. The only thing to me that they're missing is that patient suffered a skull fracture. So we need to find fracture. Go back to your ICD-10 book. Go back to fracture. Go back to fracture. That is the only thing that they're missing in this write-up that needs to be corrected. Fracture and then skull.
S02.91, which is going to need an extra character as well.
Okay, so let me write that down, what you just said. I'll go with that. Okay, you said, what is it, sweetheart?
S02.
S02. Uh-huh.
0.91. And we got to get another character. So we got to go to the tabular list.
Very good, girlfriend. Very good. Okay. Let's do that. So let's go to volume 1 and find our code. Let's go to S character.
025.
Okay. So we found S02.91, and it says it needs an anchor. There we go. An anchor and a 7th character. Okay. So unspecified fracture. Where's the peach box?
It's going to be before it. It's up under the right above fracture of vault of skull. That's where the peach box is.
Okay. Oh.
Initial, I think we didn't talk. I don't think this happened multiple times.
The patient suffered a skull fracture when overhead light fell on her. So, let's see. 50291. So we got the 9 and then the 1. And then the 9-1 says unspecified skull fracture. But over here in the peach box is saying initial encounter. Okay, so it's an initial encounter. It's not an initial encounter for open fraction because it never said it was open. It just stated to the letter that it was a fracture. So we have to assume that it was closed.
Closed. Okay.
We have to assume that it was closed. Now, if it was open, then it would say that it was an opening of the fracture. It would have to say that in writing, is what I'm saying. It has to say it in writing. Okay, but since it did not say that in writing, we have to assume that this is closed. Okay, so now here we are, sweetheart.
Okay.
So it would be XA. It would be XA. Now, what should happen is the S02.91 should be first, then the W20 blah 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 and everything else after it. It never acknowledged the skull fracture, and it should have. That makes sense, sweetheart?
Yes, ma'am.
Okay. All right. It's going on 2:15. Today is Monday. Let's see here. Tomorrow is Tuesday. I don't know if I'll be able to make it to my doctor's appointments. I don't know what the weather will say. Let me look at my notes here. Let me look at my calendar. Let me look at my calendar, sweetheart.
I know we're finna be on the tornado watch. I've been getting in these alerts on the phone.
Really?
Yes, ma'am.
Okay.
It's been looking like it was gonna rain. So.
Okay, so y'all on the tornado watch? Okay. So when do you think the tornado is supposed?
Yes, ma'am, we are. Mm-hmm.
Okay.
It's saying until 7 p.m. But what I'll do is I'll do what I usually do. I'll contact you. You can just let me know when you have available time.
Yeah.
And we'll schedule it.
Yeah, because we got this ice going on here, and I don't know if I'll be able to go to my doctor's appointments. And then I don't know Wednesday if I'm going to have my dialysis on Wednesday because of the ice and the snow on the streets. And we in Houston, we get paranoid of that because we're not used to driving on that. We're not used to that. So call
Right, that's right.
yeah, we're not used to that. So call me Tuesday, sweetheart. Let me get some time to see how this tornado thing working with you and how the snow stuff and sleetness is working with us. But call me Wednesday. Text me Wednesday morning and ask me, Miss Harper, what's up? Can we do today? Can you do
Okay,
that?
I'll put that in my phone.
Okay. Okay.
Yes, ma'am, I could do that.
Okay. Now, what question did you have for me, Angel? You said you were going to ask me at the end.
I know you mentioned to me. Yeah, you mentioned to me that I would need to get more practice even after class. Now, I think one of the students mentioned something about on AAPC website where you can sign up for a internship or externship. Are you familiar with that?
Yes, you can. Yes, you can. Now, let me explain to you the difference between the two. Externship, sounds like your program is more catered to the AAPC program. So externship, you need a sponsor from AAPC to write you a letter of recommendation that you pass your class, your teachers or somebody. Externship, you do not get paid. You have so many volunteer hours to go to a hospital. It's easier for you to get on, honestly, in my opinion. You go there, you get on, and you learn what you need to learn so many volunteer hours. And after so many volunteer hours in how you're working out with people, and they got an opening or they know of an opening somewhere, then they will hire you. Internship, that's the difference. Internship, you get paid while you're learning. So try both of them. Now, internship is more on a collegiate level, on a college, university level, and that's great. Usually, when you're getting your associates or your bachelor's or something like that, you do an internship. You get paid while you're learning. Internship is just volunteer time, but you get credit for it towards a job. But talk to your professor about that.
Okay.
Okay. But I will say this, a lot of people try to go for internships. That's great. Get you an internship. You want to get paid while you're learning. Okay. But if you get you an externship, you get it a lot quicker and they give some time to get to know you. You're getting trained and then they keep you. Internship doesn't always necessarily mean they're going to keep you. It doesn't always mean that because you got paid, but it doesn't necessarily mean that they can keep you. They just made a budget for you to come and learn, but we'll give you some sort of compensation while you're learning.
Okay.
Okay, but go for both of them. But I'm telling you, don't despise the blessing of an externship. Do not take that opportunity and run with it. But if you're doing an externship for a little bit and an internship come along, take it. Sometimes they may have a position available to keep you in. Okay?
Okay.
But I usually tell my students when they go through programs, especially these online programs or these programs that we teach at Houston Community College on campus or either online, I usually tell them you want to volunteer somewhere. You want to volunteer at least 5 to 10 hours a week, no more than 2 months. No more than 2 months. Don't give them 4 and 5 months. No, ma'am. After 2 months, or really after a month, they should know if they want to keep you or not. That means you on time when you come to work. You leave and come back on time for lunch. You leave on time when it's time to go home. You're not on Facebook and Snapchat and all like that because when you're doing coding, you ain't got time for that. You ain't got time for coding your mama and your family and everybody else. You don't have time for all that. That phone needs to be kept in your purse or wherever you keep it in your backpack. You got to keep it away because that's considered a distraction. Okay? And please take notes. take you a tablet. Where's my tablet? I've been having tablets all my life since I was 16 years old. I have a box full, and I'm 52. I have a box full of tablets that I write notes about everything because I don't want to forget. Please, if somebody teach you a coding guideline or correction, or you have a question, write that down. It's nothing worse than going to training. I don't care if it's internship or externship. It's nothing worse than going to training and they telling you stuff and you think you're going to memorize that. No, you won't. Because when you go home, your mind is somewhere else. When you come back, it's like a deer in headlights. Like what? No, you always want to write it down. And when you get home, if you can, before you relax, write down everything that you learned that day. I don't care what it is. Write it down. So if you ever have a question, you can always say, oh, I remember. Oh, I remember. Now, sometimes you still may go back to your mentor or somebody and say, I wrote this down, but I'm still a little confused about this. Tell me what this is. I get it clarity in my notes, and make this your best friend. So make this your best friend. So it takes 6 months to a year, sweetheart, to become good at this, where you'll see a constant trend of coding all the time, where it'll come to you like water. It takes 5 years, 5 to 6 years for you being an aficionado. You know how to keep up with different editions of the ICD-10 book. Every time a new book comes out, you already know what's up. Coding clinics, you need to always ask, do y'all have a coding clinic training? AAPC knows what that means. Ask them, when do y'all have coding clinics to update us? And that's under your CEUs, your continuing education units. And under your CEUs, you're supposed to go to some coding clinics, some webinars, or some, well, these days it has to be webinar. You have to go to some webinar about when it comes, boom, take it and run. And if you come with a positive attitude, stay away from, oh my God. Say, oh, I gotta go to the bathroom. I gotta go to the bathroom and turn around, come right back and go to your chair. Don't get caught up in office politics. Please stay away from that, because you will miss your blessings. Just because somebody don't like somebody over here, that person that they don't like may have all the answers. And this person over here don't like it because they wearing Louis Vuitton. I don't know, something stupid. Stay away from office politics. Okay? You'll miss your blessings because
yes, ma'am.
Miss. All right, what else you got for me, baby? Got any other questions for me?
No, ma'am, you're very internship.
Okay, if you need some help, and I'll gladly give you
my time is coming up in a few months anyway. So
okay, if you need a letter of recommendation from me, please let me know. I'll gladly write you one.
Okay, great.
Okay. All right, sweet cakes.
I will make it.
All right. Well, you have, and God bless you, honey bun. Check in with me on.
Have a fantastic day.
Thank you, honey. Love you. Bye-bye. Okay. Let's see. I see Saeed. Okay. Saeed. Let's see. Can I see that? Okay. Yes. Hi. Oh, did I do that wrong? Okay. I'm trying to get to you, sweetie. Give me a minute. Please email girl, I can't read. Email me at thcod@hotmail.com. And text me 281 723-4762. I want to help you. I want to gladly help you. Oh, oh no, that wasn't. Oh, here it is. All right, thank you, everybody. Bye.